But let's also welcome on board Viren Prasad Shetty from Narayana Healthcare to talk about how their quarter has been. Viren, hi, good to have you on ET now. The ramp-up cost of the Cayman business clearly seems to have impacted your overall numbers. Till when do you think this impact is going to linger on?
We have guided for 4 to 6 quarters. The last quarter also was a hurricane season in Cayman. And there again, that is a very hurricane-prone area. And what happened during hurricane is that patients postponed surgeries and doctors tried to reduce their output. So that has been quite impacted, but it shouldn't last beyond 4 quarters.
Until when would you exhaust the entire Capex when it comes to Caymans? Because we believe that around 60 to 65% of your cost at Cayman has already been incurred till the second quarter.
No, it's done. It's nearly all done.
Great. So for the Cayman business, your hospital started the operating services as well, while the IP business is awaiting government approvals. Till when can we expect this, and how does this impact your business overall?
As of September, we have the license to see patients. So that is the outpatient clinical work. And they've been getting a lot of footfalls, and that's been going well. Any time now, we should get the license to operate the inpatient business. It could be a week or a couple of weeks from now. And that's when it will fully ramp up. So Q3 is when we start to see the full impact of the new expansion in Cayman.
Okay, Viren, I hope you appreciate me asking this because I have a question on the margins. They have declined this quarter, and if I look at rest of your peers, they've managed to either hold on to their margins or improve that because it's a seasonally strong quarter. I understand that, of course, Caymans was a bit of a problem area for you, but in the second half of the year, what are you likely to do to, kind of limit the margin decline or at least increase it further?
A lot of things we're working on, mostly around our efficiencies and throughput. Margin decline quarter on quarter shouldn't be too much of something that you pay attention to. Ours is a very long cycle business. There was also this huge impact from the restricted inflows from international patients in Bangladesh, and we've been substituting that with domestic volume. It will take time to catch up, but the second half of the year is the time in which a lot of this should start to kick in.
Okay, you talked about the Bangladesh effect. Overall, what's the mix of international versus domestic right now, and where do you see it trending from here on?
9% of our business tends to come from international. It dropped to around, I think, 7 or 6% this quarter. The trend will be negative. It is something that will gradually decline to zero, maybe in 5 years, maybe 10, maybe even longer. It's because it used to be 11% before the pandemic. And ever since the pandemic, just international travel has become so much harder. And as a business, we are refocusing a lot more on dealing with domestic patients. So it's not a channel that we've invested too much in, and we are replacing with domestic patients as much as we can.
Point taken, Viren. Hi, morning. What about the losses in the insurance and clinics business? Because that has increased a tad. Do you think that we can see an improvement down the line? And what would be the catalyst that will help with the improvement in numbers here?
Yeah. The amount that we spend in the insurance and the clinic business would be around 33 crores a quarter. That will stay more or less stable. It's not going to go much higher. It's not going to go much lower until we ramp up the amount of intensity, both in terms of adding more people, sales, ground staff, and clinics. But it'll be offset against the growing rest of the business, the hospital business that is fairly mature right now. That will be able to take off a lot of the sting from there.
Viren, it's getting very interesting. Your businesses, you are getting into insurance. You have PB Fintech trying to get into the hospital space. Clearly, getting into each other territories. How do you see the impact of all of this?
See, in the end, it is a reflection of what the customers want. There is so much demand for healthcare in the country, and everyone is paying out of pocket. Nowhere in the world do you see a country where such a large percentage of patients coming in for healthcare services are paying out of pocket. It shouldn't be the case. People have to buy health insurance. And the reason why we got in, why Policy Bazaar is also seeing something in healthcare is because they feel that there are certain things that are limiting the expansion of health insurance market. And so we're trying to address it in our own little way. So this is something that for the next 10, 20 years, there'll be huge demand for, and a lot of players coming up with very innovative models. And we're hoping to be one among many.
In the sense of your Capex, it does seem like your net debt has gone up. If I have it right, it's closer to around 2,700 odd crores this quarter. Given the fact that you are doing a bit more expansion, should we brace ourselves for higher levels of debt, or do you think it's peaked out a bit?
No, much higher levels of debt. For the next 3 years, we'll be spending roughly 1,500 crores every year. Maybe a little less this year because we haven't been able to ramp up a lot of the Capex, but it will catch up. We have sufficient leverage. We've been historically under-levered since the pandemic, and it's something we want to deploy towards expanding our presence in all the focus areas of the country.
And will this be done, this expansion, through the inorganic route as well? Anything that you are specifically watching out for, any territory, any capability expansion?
We're trying. It's just that a lot of the inorganic acquisitions tend to be really, really expensive and highly sought after. And it tends to be that we are a little conservative on how much we pay for things, and we usually get outbid for a lot of the inorganics that we go after. So in the end, the slow burn organic acquisition, which is buying land or putting up brownfield projects near us, even though they take longer, they are what's in hand. Whereas inorganics, as and when they come, we'll pursue it, but we tend to be outbid.
Have to ask whether there's something that you've narrowed in on already, which could be next in the pipeline in terms of, bidding for an acquisition.
Oh, we've narrowed down on a bunch of things. There are a lot of these hospitals that come under the NCLT route. There are some that are managed by PEs that we're in talks with. So there are a lot of things that we're always in contention for, but nothing that we can say conclusively is absolutely done. And all I need to do is sign the dotted line, and it's there for us. We are always pursuing expansions and opportunities for growing our footprint.
Enough looking at expanding the opportunity for growth, but what about the organic route in the sense of increasing your occupancy level, increasing the average revenue per bed? Any targets that you have in mind? When do you expect to reach, let's say, 65% in occupancy?
Yeah, we are thereabouts in 65% occupancy. See, the occupancy number is not a number that will go higher or lower. What will happen is that each bed itself will start to have a shrinking number of days that the patient occupies it. And a lot of the business will be moving out of bed. A lot of our business is moving towards daycare. A lot of it is moving towards emergency department, towards critical care, even out of the hospital, towards clinics and procedures. And that is the massive lever of growth, which doesn't necessarily contribute towards overnight occupancy. And that is a trend worldwide for the healthcare industry. People don't come to the hospital just to sleep in the bed. They come to the hospital for procedures, and they want to get out of there as soon as possible. And the sooner this industry recognizes that, the more they'll start making investments to reflect what patients prefer.
No, okay, so you're already there in terms of occupancy, but then what about an average revenue per patient? Because I understand that ARPOB and occupancy might not be the right metrics. And what about average revenue per patient?
Yeah, so there is a choice that every company decides to make. Either you say, I will price my services to squeeze every last drop of blood from every single person that comes to my hospital, because clearly they're paying for their life and they should pay whatever it takes. And there are some hospitals that choose to go down that path. Or there are hospital groups that are a little more conscientious about how much things cost and try to make sure that the person is left both alive in health as well as in wallet. And that's a choice that groups like ours tend to make. So the average realization per patient goes up just through earned effort, which is doing higher end work, doing things in a more respectable manner to be able to increase the realization, not through price gouging.
Expect you to kind of take the last blood out of your patients. Hopefully none of the hospitals do that. But let me ask you a question on e-pharmacy as well, because there's this increased trend that we are hearing about quick commerce marrying into the pharmacy business as well. They are trying to deliver the medicines, at least the O2C ones, in 15 to 20 minutes. How are you looking to battle that, and what about your e-pharmacy wing?
We're not looking to battle that at all. There are some areas where we know we have some competencies in, and that is treating patients in our hospital. Whether it comes to delivering medicines to their homes, we offer it as a service across some of our clinics. But if someone's willing to do it for 90 paise to a rupee, sure, great for them. That is a business we don't imagine we would be a significant contributor in.
Right. Okay, Viren, good to have you on the show. Thanks as always for taking the time and speaking with